Hey everybody, welcome back to Drug Talk. In today's video, I want to quickly go over 3 things you should be aware of before using Concerta. Number 1, when you start using Concerta, you may experience gastrointestinal side effects. Some of these side effects seem to happen at a low rate, while others seem to happen more frequently. A decrease in appetite is the most commonly occurring GI side effect. It seems to happen about 20 to 27% of the time. Indigestion occurs in roughly 2% of patients. And nausea can happen in between 6 and 13% of patients. Upper abdominal pain occurs 6 to 9% of the time, and vomiting can happen up to 9% of the time, and dry mouth or xerostomia can happen around 14% of the time. Many of these side effects will subside after some time on the medication as your body gets used to Concerta. However, if they seem to persist and they're really causing some negative effects for you, be sure to have a conversation with your prescriber and make a plan on how to move your care plan forward. They may choose to alter the dose of Concerta or switch to another medication altogether. Number 2, aside from the GI side effects or gastrointestinal side effects, you could also experience psychiatric side effects. About 8% of patients using Concerta have reported experiencing anxiety. Although the frequency is low, just about 3%, some patients have experienced depression. Irritability can occur in up to 6% of patients, and hallucinations is also a rare occurrence. Similar to what I mentioned for the GI side effects, many of these side effects could subside over time after your body gets used to using Concerta, but it could be helpful to track these psychiatric side effects. You can use journaling to track your mood, documenting things like anxiety or depression, so that when you go into your appointment with your prescriber, you have really good details of how this medication is affecting you, and they can use those details to help make a plan and a detailed path forward. These details that you document in that journal can really help them plan out what the next step is. Number 3, there is a black box warning for Concerta regarding misuse, abuse, and addiction. So there is a high potential with this medication for misuse and abuse, and this can lead to substance abuse in general or addiction. Misuse and abuse of CNS stimulants, such as methylphenidate, can lead to overdose and death for some patients. The risk is increased with higher doses or unapproved methods of administration, such as snorting or injecting. So before we prescribe these medications, like Concerta, to patients or clients, we have to make sure we assess them for the risk of misuse, abuse, and addiction. Patients and their families have to be educated on proper storage and proper disposal of these medications. You can expect, if you're using Concerta during follow-up appointments with your prescriber, that they will assess you for your risk from baseline to that current appointment for misuse, abuse, and addiction. That's all we're going to discuss today with Concerta, but before you take off, I wanted to quickly let you know you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.